Hi everybody and welcome to pre-record session 2. So in this session we're going to start to look at types of different harmful sexual behaviour. And you can see here that we've highlighted 3 different types. So harmful sexual behaviour involving peers. And when we talk about peers and young people, we stay away from language of perpetrator, and we talk about the child that's harmed and the child that has been harmed. We're also going to think about sibling sexual abuse, which, as you know, is more common than perhaps we would like to think. And we're also going to think about abuse that takes place through technology. And we know that the use of technology occurs in all different types of sexual abuse. So at the bottom here, you can see that I put a couple of infographics. One is for CEOP because they still are one of the best places to go to for information and support. Children can use the CEOP reporting link. If they are worried about, somebody's behaviour via technology, for instance. And also the Sibling Sexual Abuse Project has some really good information, as well as the CSA Centre. But there's some things that you can download from the conference directly on the Sibling Abuse Project. So here we have Simon Hackett's Sexual Harmful Behaviour Framework, which is a really useful one to have. I suggest you find it and download it. You've got the small version of it on this PowerPoint, but it really helps us think about how sexual behaviour is in a spectrum. So we've got the kind of usual developmentally expected, socially accepted behaviours where they're consensual, they're reciprocal, they're shared decision making, and most children, and young people who embark on a sexual relationship will be within that scenario. But then maybe there'll be some instances where it feels inappropriate. So that might be a single one-off incident where there was some inappropriate behaviour. Maybe it's been socially acceptable within the peer group, but professionals don't find it socially acceptable. Or maybe the context was inappropriate. Generally, however, it's consensual or reciprocated, but inappropriate. And then we've got problematic, where there is concerning or problematic behaviour. Maybe that developmentally is unusual, or it's kind of socially unexpected in that setting. We're not really sure if it's consensual or not, and there may be a lack of reciprocity. I'm never quite sure if I say that right. And we're not sure about whether the power relationships are equal, and there might be some compulsivity in that as well, so some compulsive behaviours. So from problematic, then our next step is abusive, which is where there was a intent around victimizing somebody, and the outcome was victimizing of someone. So there's a very, obvious misuse of power there. There's coercion or force to get compliance from the victim. So in that sense, there's, definitely not any informed consent because that couldn't be freely given by the child or young person. So within that, we are thinking that maybe there's some violence as well. Which brings us to the last category, which is the violent behaviour. So that could be physically and sexually violent and abusive. It's highly intrusive in its nature, and the type of behaviour, is psychologically and sexually arousing for the person who has that harmful behaviour. So we're thinking about things like sadism then. So most children and young people won't fit in the violent category. Largely they'll be in the normal with some, inappropriate. And as we get up the scale, we're likely to see less and less children. But then within the social care setting, we're thinking about those aspects along the spectrum, which are obviously problematic because that's the kind of thing that we're dealing with. So when we're thinking about siblings, then there's also a useful continuum here when we're thinking specifically about sibling relationship. So it's very similar in its nature. So we look at what's normative. So, many siblings will have a level of sexual play with one another, experimental, that's within a developmentally appropriate way. But then we also know that some of that can fall outside of the developmental norm and then can cause developmental harm. And then we've got sibling sexual abuse, where there's very, specifically physical, sexual and emotional harm, where there's coercion and force, a lack of consent. So you can see it works in a very similar way. to the previous infographic. And there's a really useful tool on the CSA Centre now helping us think about how we assess these things when there's sibling abuse. So here's a really nice little chart that I've taken from the CSA Centre resources, where we've got the presenting behaviour. So what we would do is we would assess the nature of the behaviour first. Is it developmentally appropriate? If so, we can reassure and address any other concerns. We would, if it was inappropriate, we would speak to all the children involved, and maybe we would do some further assessment. We'd look at whether there's any other harm happening at the same time, anything else co-occurring. And then, of course, with that, we would safety plan. And then if we think it's problematic or abusive, we have to be really open to the idea that, you know, this is deliberately harmful. And so, again, we would assess. Really comprehensive assessment, however, you know, a much greater assessment in this case, we would safety plan, and we would have very specific interventions around that as well. So let's move on now to thinking about vulnerability. So any child can experience any of the things that we've just talked about, and being a child makes you inherently vulnerable. And the abuse doesn't occur because of a child's vulnerability. It occurs because an offender has an inclination and the ability to take advantage of that vulnerability. All children are vulnerable because they're children, because the power imbalance that exists between children and adults. Having said that, however, we are going to look in the next slide around the things that we know from research which have come up frequently within children's kind of histories, their context, their experiences, which we can then think about as making them particularly vulnerable or targetable. So here we have the risk factors from the Research and Practice organisation, and they've got this really useful toolkit here that you can see, this practice tool. So what they found in their research was that these factors seem to be significantly present in the case histories of the children who were abused in this way. So within the parenting, there was very low parental satisfaction. So maybe, you know, the parents didn't feel very skilled in parenting. Maybe they struggled with attachment relationships. Maybe they had their own trauma. We also know that the age was a factor. So with interfamilial abuse, it much more frequently started before the age of 9, whereas other types of abuse in sexual abuse tend to start a bit later. So with interfamilial abuse, it tends to start younger. If you're female, you're more likely to be abused. If you're in a single parent family or you have a step parent, again, the stats are higher. If you have vulnerabilities like you're neurodiverse, you know, you've got physical difficulties, those things will make you more vulnerable. We talked about that earlier. If you have a parent who has had experiences of sexual abuse but that was unresolved, so maybe they haven't come to terms with their own grooming process, maybe they're still in contact with the abuser, that will make a child more vulnerable. Again, maybe, you know, you have a mum who's experienced sexual abuse where she hasn't, you know, had the support or capacity to come to terms with that. Maybe that makes her really emotionally unavailable, or maybe she's unavailable because of economic factors and has to work late and long hours. But that lack of a parental figure being around obviously makes you more vulnerable. I think we have more research on mums than dads, which is why it's focused on mums. Other things that make you more vulnerable are, you know, parenting capacity being lacking in terms of, you know, children being neglected, children living in poverty, again, causes a lot of stress, a lot of extra tension and difficulty within the family. And those relationships then can get really strained when we're thinking about attachment relationships, when we have all of those other, you know, difficult, challenging contexts. So the quality of the parent-child relationship will make a difference. So I hope you enjoyed listening to that section. In the next live session, we're going to be doing a couple of case studies and yeah, inviting you to think further about the vulnerabilities and what perhaps perpetrators look for when they're targeting children and thinking about the grooming process. Thanks very much. See you in a minute.